Good afternoon, everyone. This morning, Fran and I watched the first shipment of vaccines arriving at Mercy Health Springfield Regional Medical Center. While we were in Springfield, Lieutenant Governor Houston was watching the vaccine delivery at Ohio Health Riverside Methodist Hospital in Columbus. Across the state, shipments also arrived today at Albany Hospital in Canton, Mercy Health St. Vincent Medical Center in Toledo, Genesis Hospital in Zanesville, Metro Health in Cleveland, and also at the Cleveland Clinic. Today, we'll have the opportunity to talk to some people who are receiving those shots and some people who are involved in administering the shots. We'll talk to some people from around the state. But first, I want to talk a little bit about where we really are today. Yesterday, the University of Cincinnati Medical Center and the Ohio State University Wexner Medical Center started vaccinating healthcare professionals involved in the care of COVID-19 patients. Vaccinations are continuing today at both of those hospitals. While supplies are limited right now, we have been told that we will continue to get vaccines throughout the rest of the month. And so these are the estimates that we will get. We won't know until we actually get them, but this is what we have been told. This week, we have received 98,475 doses from Pfizer. Next week, we should receive an additional 123,000 doses from Pfizer, as well as 201,900 from Moderna. Combined, that means that by Christmas, Ohio should receive more than 420,000 vaccines. During the week of New Year's, we should receive an additional 148,000 Pfizer vaccines and an additional 89,000 doses of the Moderna vaccine. Certainly, all of that is very, very good news. So I mentioned this morning, Fran and I were able to visit the loading dock in Springfield at Mercy Hospital. One of the first individuals, we had the opportunity to talk to a moment ago, was Casey Gardner. She's a nurse in the Progressive Cardiac Care Unit. And Casey, are you ready to get your shot? So Casey's in Springfield, and we're ready to go, and we're going to watch her get her shot.
All right, Casey.
Hello.
Are you ready? Yeah. Big sick. Good job.
Good job. That didn't even hurt.
Okay, Casey, tell us a little bit about what you do at the hospital. What's your job?
Well, Governor, I am a nurse on the Progressive Care Unit at Springfield Regional, which is 3 North. And I also have had the opportunity to go and work on one of the COVID units here at the hospital. So I've been a nurse and have been in the front lines. And so as I thought about it, I just didn't want to inadvertently cause someone else to get it when I can vaccinate myself. I just completed a nurse practitioner program, and I feel like I'm a strong vaccine advocate, so I had to step up.
Well, we appreciate that very, very much. And your message to anybody who's, about to get the vaccine or thinking about get the vaccine would be what?
I would say to, number one, trust. And number two, talk to those around you. My primary doctor is Dr. Michael McKee here in Springfield, and he was excited about the vaccine. And I don't think that I would have, even as a healthcare professional, had the nerve to get it if I hadn't sat and talked with my doctor and really felt his enthusiasm for it.
Well, that's great. So how do you feel? You doing okay?
I feel fine.
Okay. All right. Well, look, thank you very much. Fran and I were in Springfield this morning. It was exciting to see the the unloading of the box. It's kind of a big box, as you know, because it's got all the dry ice in it. But then when they open it up, it's not too big. But thank you for what you do. Thank you for taking care of patients, and thank everybody else at Springfield Mercy. We just appreciate what you all do, and I know that you're going through vaccines today. I think about 100 people today, and then I was told maybe 300 tomorrow and 300 for the next 3 days. So thanks for being with us, and again, thanks for what you do every day.
Thank you.
Thank you.
Thank you. And I want to thank you for your leadership in this endeavor.
Thank you very much. Have a good day. We appreciate it.
Thank you.
Thank you. So let's go to Toledo, an exciting day in Toledo. Joining us is Dr. Kevin Casey, Chief Clinical Officer of Mercy Health in Toledo. How are you doing? Hey,
Doing
Doctor.
very well, Governor DeWine. Thank you. How are you?
I'm well. So have you all started vaccination yet? Have you started the process?
So we received our vaccines today, and we're starting our vaccinations today. Yes.
All right. And behind you, I guess, is that where it's going to take place?
It is. It is. In fact, we're about to start with probably the leader of our critical care team here and the one who's been a tremendous leader through this entire COVID pandemic for us, Dr. Tita.
Oh, very good. Very good. Well, this has to be exciting for you and other health workers, I'm sure. Been waiting for this day a long time.
There's been a lot of anticipation behind this day. We've had a vaccination committee that has been planning for weeks, following the guidelines given to us by the government about who of our frontline healthcare givers should be receive the vaccination. We've gone through that list, and we have a number of people who are just so excited to get it. It is a very exciting day for us.
Well, that's great. I was going to ask you what the mood is there, and I guess you said there's a sense of excitement and enthusiasm, so that's great.
It's almost as if the race is about to start. We've been waiting for this gun to go off. We've been prepared for this for so long, and we're just all excited finally that the race has begun.
So, this is, Doctor, this is the beginning. We know it's going to take a while to get to the average person out there. And maybe what is your message? This is a day of hope. Yesterday is a day of hope. We see our frontline health workers being able to get vaccinated, as well as we're going to start on Friday, our people in nursing homes. But kind of what would be your message as a doctor to people out there who are watching today?
Sure. Thank you. As a good friend of mine shared with me a couple of days ago, this is just the beginning of the end. It is not the end. And it's great to be able to offer some level of protection to those healthcare heroes that have been caring for us through this entire pandemic. But we're not near the end yet. It's only the beginning of the end. And we need to continue to protect our healthcare givers. We need to continue to protect the people in our community. So I would ask that everybody continue to mask up, do the hygiene, the physical distancing, all those things that we've been doing for the past few months, so that we can keep each other safe and continue to provide that high quality and safe care that our community deserves.
Well, we appreciate it. We wish you well today. How many people today, and then maybe how many tomorrow? Have you got that figured out?
Well, people have it figured out. I just know we're going to do as many as we safely can every day that we can.
Well, I like that. I like that attitude a lot. And I'm looking at turn around and tell me what I'm looking at back there.
What you're seeing behind me is Dr. Jim Tita, our critical care physician. Again, the one who really has been the tip of the spear through the COVID pandemic for us here in Mercy Health Toledo. And there is no one more deserving to receive this vaccine today than him. I am so appreciative of his leadership and how he has brought the entire team together. Cannot say enough about the team we have had here caring for our people.
So it looks like who's ever given him the vaccination is kind of going through the protocol back there.
Yep, they're going through the list, answering all the questions, confirming who he is, doing all the things that we do before we give any vaccine or care for any patient of ours. And then when everything checks out and he's prepared, he will receive the vaccine.
Okay, we're going to watch this then. We'll watch over your shoulder if that's okay. Looks like he's ready. There we go. All right. Well, Doctor, thank you very much. Good luck today and this week, and thanks for all you do, and thanks for all your team does.
Thank you very much, Governor DeWine. Have a wonderful day.
Thank you very much. We're going to go from Toledo to Zanesville. Today, we're speaking with Ryan Smith, a registered nurse at Genesis Hospital in Zanesville. Ryan is the clinical coordinator of critical care. As an essential caregiver fighting the pandemic, Ryan, I guess, have you already got, Ryan, you got the vaccine today?
I did. I got the vaccine this morning.
Well, very good. Tell us a little bit about what you do.
Sure. So in the critical care, we typically have the sickest patients in the hospital. Currently, our staff is caring, or our population in the critical care is about 70% COVID-19 related illnesses. So we're seeing an abundance of COVID-19 of some really sick patients.
Yeah. How long have you worked with COVID patients throughout the pandemic, or?
We saw our first COVID-19 illness in the spring this year. We didn't see a lot really until the past 2 months.
And just tell us a little bit more about what you're seeing, what age you're seeing, or anything else that's of interest.
Sure. So most of our patients are 60 and over. We have had some as young as in their 30s. Really that's about it.
Yeah. Well, look, we wish you well. We want to thank you for what you do. Thanks for taking care of all patients, and please thank everybody else at the hospital. We appreciate that, and we hope the vaccinations go well over the next several days. You know how long it's going to take you to get everyone or go through that 975, or do you have any idea?
We vaccinated over 30 people so far today. I believe our plan is to get those out through the rest of the week, and hopefully we can get them out as quickly as possible.
Good.
We want to get. I'm sorry.
No, that's great. That's great. And then in 3 weeks or so, you'll be back at those same people. So getting that second one. So thank you. We appreciate what you do.
Thank you, Governor.
Very, very, very much. We're going to go now to Canton. Dr. Boutros, the Medical Director of Critical Care Services at Altman Hospital, is joining us today from Canton. This afternoon, healthcare workers at Altman are beginning to receive the first dose of the vaccine. Dr. Boutros, you've already got your shot, I believe. Is that right? Oh, we got to get him unmuted there. Let's try again. Yeah.
Yes, I just got my shot half an hour ago.
And doctor, tell us, I mean, look, this shot is just, people just started getting it today and yesterday. And if someone is watching this on TV, what do you want them to know about the shot, the safety of the shot?
Yes, I think the safety has been established. People have been followed longer than 2 months. Side effect limited to fever, chills, body ache, local pain, headaches, lasted for 24 hours. If that's all it's going to take to alleviate suffering, let it be.
And some people I know are concerned, maybe because of what they've read about other vaccines, that maybe you could get COVID from this vaccine. You want to address that?
You cannot get COVID from this vaccine because there's no virus is being given. This is not a killed or weakened virus. You cannot get COVID from getting this vaccine. Period.
Okay. Very, very good. Very good. Well, your vaccinations are going to spread over a few days, I assume. You got started today, I believe.
Absolutely.
Well, we wish you well. We wish you well, and thank you and your team, everybody at the hospital for everything that you do. We're very, very grateful.
Thank you, sir.
Thank you, doctor. We're going to go now to Dr. Jennifer Wall-Forster, who has joined us before. Doctor, thanks for being with us again. We appreciate it very, very much. Tell us a little bit. We wanted to ask you about a question that we get. from people, and that is, I've got symptoms. At what point do you call a doctor? Then let's say you've called the doctor and you're staying home and you're following what the doctor tells you to do. If it doesn't go well or it gets worse, at what point do you call 911? What point do you do whatever needs to be done there?
Right. This is a great question. And thanks, Governor, for giving me the opportunity to speak to Ohioans again. It's really important just to get care when you need it. Problems like difficulty breathing and chest pain really should not be ignored and are definitely reasons to go to the nearest emergency room. It's a bit harder, though, when you have those mild, non-specific symptoms. It's really hard to determine what you have and when to see a doctor. Now more than ever, though, especially as we kind of get into flu season and or we're in flu season, you really should talk to your doctor early so you can, A, make a difference in your own care, and B, also potentially decrease the spread of this or other viruses like the flu. And that's what we're here for as doctors. The symptoms, like we said, a runny nose, headache, fevers, they're so common with COVID, but they're so common with the flu. They're so common with other viruses, and they can even be signs of something, either bacterial illness or even non-infectious problems. So speaking with your doctor earlier will help you determine which of the tests you need, flu, other respiratory viruses, and a COVID test, obviously. And this can be important in your own care because thanks to the FDA's emergency use authorizations, not only of the vaccine, but also of some other treatments like bamlanivimab, which is a monoclonal antibody that blocks a little protein on the SARS-CoV-2 virus from attaching to human cells. And this infusion can actually be given to some people and may help them from getting sicker and keep them out of the hospital. There are other monoclonal antibodies similar to this that may be in the pipeline as well. So you may be actually a candidate for getting some treatment to help you get better. If you do get tested for COVID-19, it's important to know what that result means, though. I think we've talked, Dr. Vanderhoff, and you have talked about this previously. It's important to know what that result means so that you do the right thing. First, if it does happen to be positive, just remember to isolate yourself to prevent the spread of COVID-19. And obviously, like I said, ask your doctor if you qualify for a treatment. But if you're feeling bad and the test is negative, it's still important to monitor your symptoms and talk to your doctor, especially if you're not feeling better, and definitely if you are feeling worse. Remember, the test could be a false negative. Maybe it wasn't the best sample. Maybe it was too early in your disease course that enough virus wasn't available for the test to pick it up. And so maybe you should be tested again. Maybe you should be tested for the flu. Perhaps you have, like we said, a bacterial infection or something else that we can have some treatments for. So just keep open lines of communication with your doctor. We're here to make sure you get through this. So that's what I would recommend. Talk to your doctor as much as you feel when things change or something just doesn't feel right for you.
So the infusion that you talk about, is that generally available throughout the state? If somebody is watching this, you see, but if someone's in Toledo or someone's in Zanesville or Lima or someplace else, is that something they should at least talk to their doctor about?
They should definitely talk to their doctor. I believe it is initially it was a bit limited, but there have been more shipments throughout the state, and it's fairly widely available, maybe not directly where you are, but certainly likely somewhere close. And it's an infusion. It takes about an hour. Honestly, generally well tolerated from what I've seen from patients getting it. And again, like I said, this can keep people from getting sicker and stay out of the hospital, which is good for everybody.
Yeah, so that can potentially keep you out of the hospital, which is, no one wants to go to the hospital. They don't have to go to the hospital. So tell me again, though, let's say I've seen my doctor, I've got a test, I'm positive, I'm at home, and I'm going along for a while, and then something happens. And what should I look for? I mean, what should alarm me enough to maybe either call my doctor or to call 911? What's the alarm that goes off?
Really, what we've seen for COVID-19 is really the difficulty breathing. That's really the symptom that is likely going to require some kind of care in the hospital. Sometimes this can also be chest pains. There are some things that can be associated with COVID-19 infections, like thrombotic events or clots that can happen in different parts of your body. And so those are important once you have COVID, that sometimes it might not be the virus itself causing worse symptoms, but something that the virus did to your immune system that caused it to react this way. And those are really important reasons to go to the hospital. I would also say things like leg swelling that's different from normal, those could be signs of clots in your legs, or even signs that your heart might not be pumping as great as it could. And we do know that COVID-19 can affect the heart. So those are really the big issues. And I would say if you don't feel like you can go through your normal activities of the day, and that you're unable to eat or drink or actually take care of yourself, which hopefully if you have someone at home that can help you with that, great. But if you can't, we're here to help you, because we want everybody to really make it through this.
And tell us about, and you talk about breathing problems. Tell us about, the oxygen level. I know some people, because they have asthma, are familiar with oxygen level. They're familiar with, what's it called? They put it on your finger.
Right, the pulse oximeter.
Yeah. So let's say you've got one of those, or you got a loved one in a nursing home and they're checking on them. What level do you get nervous about?
Right. So, honestly, around if you're normally around 99 to 100%, that's where most of us who aren't on oxygen, or even sometimes once you're on oxygen chronically for some of the medical problems, like you mentioned, some chronic lung diseases. If you are less than 95%, those are times where, we're concerned about something different going on. Now, sometimes people in their doctors may be monitoring that. And that if you go lower than your normal, you should talk to your physician if you're not sure what to do. But generally around, 95%, if you're normally 99 to 100%, that's a time to be pretty concerned.
Okay. Well, we appreciate it very, very much. I forgot to give you a proper introduction, but Dr. Forrester, Associate Chief Medical Officer at UC Health, Associate Professor, Infectious Disease Doctor at UC College of Medicine. Doctor, thanks for being with us again. We appreciate it.
Of course. Thank you.
Thank you. We'll now go to the Lieutenant Governor, who will tell us a little bit about his trip to Riverside Hospital today.
Thanks, Governor. Yeah, it was an exciting visit to the Ohio Health Riverside Methodist campus in Columbus. You see me there with the president of Riverside, Rob Sirsick, and then Dr. Joe Gestalto, who's the specialist in infectious diseases. He's been on the news conference before. You see that box there. It's I heard it described as a cardboard box full of hope today, because it's it was pretty special. You could see the excitement among the people who were there in the Riverside community. I've heard it described that what's inside of there is life-saving, that there are going to be people whose lives are saved as a result of that. You saw the refrigeration unit. Refrigeration is an understatement. 75 degrees below 0 Celsius is what that gets to. And they were excited, but the team was ready. They're gonna distribute those vaccines over the course of the next 24 hours to the staff that confronts these issues on a daily basis. And another important part about this delivery is that half of the delivery is going to go to the Ohio Health Oblessness Hospital in Athens, which is the only pre-positioned site in Southeast Ohio. So they are positioning those vaccines in Southeast Ohio to help the communities down there and the healthcare workers there. There was a lot of excitement at the hospital today. The term I heard often is that this is the beginning of the end. We know we have a lot to go, but it was hope. And it was the beginning of feeling, I think for many of them, that they didn't just have therapeutics, but they had a weapon against the virus that will work and ultimately defeat it. And so there was a lot of excitement, enthusiasm for the beginning of this process. So it was great to be there. And thanks to all those healthcare workers that are out there, really just doing amazing things for all of us. Thanks, Governor.
Lieutenant Governor, thank you very much. Eric, let's go to the slides real quick. Today, we're reporting 8,755 new cases in Ohio. Sadly, we had 103 deaths reported since yesterday. In addition, we have 614 new hospitalizations, which is the second highest of the pandemic to date. There were also 74 new ICU admissions reported, which is about twice as high as the average during the past 3 weeks. In a moment, we'll have an update on the number of patients who are currently hospitalized or in ICU. Let's go to our top 88 counties, the 88 counties in Ohio, but we'll look at which ones are top, which ones are down. Holmes County, clear at the bottom of the spectrum with 377 cases per 100,000 residents. Even though it is the lowest county in the state as far as spread, they are still almost 4 times what the CDC says is high incidence. So it's high every place. We currently have 29 counties with a case rate above 1,000, which is 10 times higher than the CDC's threshold for high incidence. We'll look at the 20 county list. That's the top county now, starting with Jefferson County, eastern part of the state. And you can see these counties are now really kind of just spread out at our top counties geographically all over Ohio. We'll look at the hospitalizations. Certainly a lot of reason to be optimistic because of the vaccine. We have our work cut out for us, though, to slow the spread of the virus until enough of our fellow Ohioans can get vaccinated. We must continue to try to do everything we can to prevent overwhelming the hospitals. The data today tells us that Ohioans are being hospitalized at record numbers. And you can see the chart there. Today we have 5,296 patients who are hospitalized. 1,311 of those patients are in the ICU, which is the second color there. We now have more patients just in the ICU than we had total for all COVID patients hospitalized during our previous peak last summer. We also have 863 patients who need a ventilator. As recently as a month ago, there were just 360 patients on a ventilator. Next week, we expect our local health departments to begin receiving vaccines. Today, we are sending them additional guidance on who should be prioritized and where they should start the vaccination process. Local health departments should coordinate vaccinating of congregate care residents and staff, such as those at nursing homes and assisted living facilities who are not enrolled in the federal long-term care pharmacy program or are not registered as providers themselves. So in other words, most nursing homes will not be handled by the local health department, but only those who have not registered, who have not signed up with one of the 4 pharmacies to do the vaccination. So the local health department will be doing those that have not signed up with those 4, any of those 4. This congregate care group that we're talking about also includes people with developmental disabilities and those with mental health disorders, including substance use disorders, who live in group homes, residential facilities, or centers, as well as the staff. In addition, local health departments should prioritize vaccinating other healthcare providers who are not being vaccinated by hospitals and health systems and not enrolled as providers themselves. These providers could include home health workers, hospice workers, emergency medical service responders, primary care practitioners, freestanding emergency department, urgent care pharmacy and dialysis center providers not vaccinating by hospitals or healthcare systems, dental providers, public health employees who are at risk of exposure or transmission, such as those who do the vaccinations themselves, mobile unit practitioners, federally qualified healthcare center providers, and high-risk ancillary healthcare staff members. So that is a illustrative list of those individuals who the health departments will be vaccinating. So we will be providing the health departments today with this guidance. At the same time, they will get a list of those places that are not being covered by someone else. So in other words, the congregate care facilities that are not being covered by someone else. I believe we're ready to go to questions.
Governor, first question today is from Bennett Haberly at WBNS in Columbus.
Hey, Governor. Good afternoon.
Afternoon.
My question is, you have previously said that Ohio doesn't have enough money to pay for the vaccines distribution, and you've urged Congress to pass a bill. They're meeting this week. I'm curious, if they fail to act, what will Ohio do to get the vaccine out there? And can you talk about who's further down the line in getting this? The school teachers?
Yeah, if I said we didn't have enough money to pay for it, that was, I misspoke. We do need Congress to step in, but these vaccinations will take place one way or the other, whether Congress passes a new bill or whether it doesn't. This will happen, and we will find a way to pay for it. So I don't want anybody to worry about that. People should not worry about that. We will get this done. Vaccinations, there'll be nothing to slow these vaccinations down.
Can you say what monies will be used to do that then?
Sure, we have CARES Act dollars. We have other potential sources. So, look, this is a priority. We have to get people vaccinated just as quickly as we can. Now, look, it would make it a lot easier if the federal government comes in with a bill. This is only one of the reasons why we've asked the federal government to pass a bill in this lame duck session. I don't know whether Congress is going to do this or not. We hope they do, but we will get people vaccinated in Ohio.
Next question is from Andy Chow at Ohio Public Radio and Television.
Andy.
Hi, Governor. I'm wondering if you and maybe if Dr. Vanderhoff is on the call too, if you could maybe talk about the pace of distribution. I think you were saying that, we heard that 30 vaccinations were administered at one hospital, maybe 100 at a different. To me, it sounds a little low, but I'm not sure what a typical pace of distribution is. Is that low? And is there any concern that there's a reluctance among healthcare workers to get the vaccine?
Each hospital, Andy, gets in this batch, and this is just an initial batch, 975 doses. I believe these hospitals, at least the ones I've specifically talked to about this, have said they will get the people vaccinated, by the end of this week. In other words, they will go through a process. Some of them are doing a trial run day where they start maybe, like for example, Springfield. Springfield's doing 100, they told me today. Tomorrow they'll do 300, and then 275, whatever it takes to finish it out. And, they will be done with that vaccination round. Now, they still will have people to go. I mean, think about the, hospital as big as the Cleveland Clinic. Obviously, they've got a long, long way to go. So this is just a start. When Moderna comes in, we hope next week, we're going to have a significant amount, and this will then go out to virtually every hospital in the state, and they will start vaccinating people. So it is a process, and I'm an impatient person. It's never going to be fast enough for me, but our job, we believe, is to do everything we can to keep this process moving. So, on the one hand, you got over 100 health departments that are going to be getting the vaccine very, very shortly. And they're going to be sometimes doing the vaccination directly, sometimes handing that off to somebody who has the ability to vaccinate themselves. We also have the 4 pharmacy companies. The two biggest ones, of course, are CVS and Walgreens. They're doing all the nursing homes now. We got hundreds and hundreds of nursing homes. So it's going to take a while, and they have already started the scheduling process. We hope that will start on Friday. Local health departments, as I read through the list of those that they're going to be doing. EMS, for example, generally are going to be done by the local health departments unless they're attached to another, to a other medical facility. Bruce, you want to answer that? I see you on the screen.
Yes, Governor, thank you. The only thing I'd add to the governor's very good summary is that this is not at all unlike how the large mass vaccination programs are conducted in hospitals every year for a flu. Usually at the beginning of that vaccination season, you take an initial smaller step into the process, make sure that you've got everything lined up, that the process is going to work smoothly when you bring larger numbers of people in to complete the vaccination. So, Andy, it's a good question, but I think that what you're seeing is pretty typical.
The other thing, Andy, to keep in mind is of this first batch that came in from Pfizer, the way it had been worked out with the federal government, most of those are going over to the pharmacies who are going to start vaccinating on Friday. So most of these are going over and will be there to vaccinate people in nursing homes. A little less than 10,000 were set aside and went out to 10 different locations, 10 different hospitals around the state. And that's what you're seeing today. But when we get to Friday, you'll then see that it kick in, and it will continue to get faster and faster as we move forward.
Next question is from Ben Schwartz at WCPO in Cincinnati.
Hey, Ben.
Hi, Governor. You and some medical professionals you've had on recently have told us that we're not at the end of our fight against COVID, but we're at the beginning of the end. So I guess I'm just wondering, is the elderly and the state's elderly population and healthcare workers getting vaccinated the main hurdle that we have to get past right now before getting much closer to that actual end?
Well, Ben, I think it's a continuing process, frankly. I mean, we look at the people in nursing homes. We know over half the people who have died have come out of nursing homes. So we know that we need to get that group protected just as quickly as we can. We also know we need to protect the frontline health workers so they can continue their great work and so we can protect them. But those are both pretty big groups. And so it's going to be a while to get through those groups. Then we're going to go into the next level. But no, it's going to be a continuing process. And there's no time really during this that we're going to be able to say, okay, let's go rest. We don't worry about it anymore, because we ultimately want to get that herd immunity, which, I'm told is somewhere between 70, 75%, something in that neighborhood. So we got a long, long way to go. The good news is we've started, but we have a ways to go.
Next question is from Andrew Welsh-Huggins at the Associated Press.
Hi, Governor. I was hoping to ask you real quick in honor of Lame Duck Session, if I could actually ask you to look ahead real briefly to the next General Assembly, and two-part question. Are there any COVID-related priority bills that, weren't around this year that you would hope the legislature might take up? And then similarly with the state budget proposal coming up, any chance you could just outline generally what spending priorities you might be looking for in that budget proposal, again, in terms of fighting the coronavirus?
It's going to be very important for us to continue to shore up our health department and the 113 health departments around the state. Some of this we can do with CARES Act dollars. Some of this is going to be more long-term structural challenges, but that certainly is a priority. And if you talk, your question, I think, was just focused on COVID. We have other priorities out there. But as far as COVID, making sure that we are able to battle the COVID, making sure our local health departments, those who are literally at the front line in every community, making sure they have the resources, making sure we have the resources, making sure we have the technology. So all of those things are very important. We have a health department and a health system, public health system that's been neglected for too long. And, one of the lessons from this pandemic is we cannot continue that. We have to pay attention. So, those would be things that we're certainly going to be looking at in the next session as far as COVID. Another thing that's certainly going to be a priority, and let me just say, the legislature has been great to work with in regard to prioritizing where money goes to deal with the COVID problem, whether it is helping with small business or whether it's helping in tracing, whether it's helping in making sure the money is there in regard to the testing. We've worked with them. All the dollars that have flowed through the controlling board obviously that's legislators who are on the controlling board. And so it's been a good working relationship, and that will continue into next year. We're going to have the need to continue to, run those dollars through the controlling board and get them out and to fight this virus.
Next question is from Jackie Borchard at the Cincinnati Enquirer.
Jackie?
Governor, there was a disturbing story in the Cleveland Jewish News last week of a long-term care facility in Beechwood where the staff was allegedly falsifying COVID test results so that staff members who were infected could come into work. How is this allowed to happen, and how is the state making sure long-term care facilities are following the procedures that are in place that are supposed to protect these residents?
Well, it's the first I've heard of that. My team may know about it, and they may be working on it. So I will check that out, and we will report back. I mean, if that is true, that would be totally outrageous. That would be wrong, and but we'll check it out.
Next question is from David Winter at WKRC in Cincinnati.
Hi, Governor. Are you able to hear me okay?
I can indeed. I can see you too.
Okay. All right. Should have removed my glasses then. Hey, real quick, where do things stand in reference to inmate populations and those that are administering them, so the staff at jails and prisons? What are the state's recommendations for when the people who are incarcerated are going to get vaccinated?
Yeah, that decision has not been made yet. We have focused on 1A group, which is a pretty big group. I think with 1A, there's a real consensus that our healthcare workers, particularly those who are dealing with COVID patients, but our healthcare workers and the people who live in congregate care settings, who are the most vulnerable, that these are the two first groups that should get the vaccine. And we're following basically, I say there's a consensus because as far as I know, every state's following that. And that's what the federal government recommended. Once you get beyond that, however, my guess is you're going to see some states go different ways because you get into some real equity questions. And so we're still looking at that. We're listening to people. We're having people call us and people who are writing us and emailing us and say, my group needs to be in this next group. My group needs to be, and they all have a good case. We're particularly concerned about our Department of Rehabilitation and Correction workers. I've process of writing notes to two families who lost a loved one who worked for the state of Ohio, worked for the people of Ohio, and worked in our prisons. And they got COVID. So, our heart goes out to them. And so those workers in the prison are certainly going to be a high priority when we look to the next ranking. But that's a work in progress. It is not done. And we're open to, people coming forward with ideas and suggestions. It gets much more difficult once you get beyond this group that I've already described.
What criteria will you use to determine whether the prisoners are going to be considered in the next tier?
Well, I think you try to weigh these things out, and there's many things that you are concerned about. One is saving human lives. That's important. The other is spread in the community. So those are two different criteria that frankly are both very, very important. And we'll have to make those decisions.
The next question is from
Those are the issues. Those are the issues that how do you keep it from spreading, and how do you save the most lives as quickly as you can.
Next question is from Tom Bosco at WSYX in Columbus.
Hi, Governor. The federal government has asked all states to sign a data use agreement, essentially urging states to send the federal government personally identifiable info on who gets the vaccine. Several governors and health organizations have objected on privacy concerns. What information will Ohio be sending to the federal government? And what is your take on those concerns that other governors and organizations have?
Yeah, I'll check on that. I don't know if our team has looked at that, and we'll get back to you. I think one thing that has to be kept in mind is it's very important under the protocol that we have that the person who got the first shot gets the second shot. They need to get it in a timely manner, and we need to make sure they're getting the shot from the same company. So, and that's the protocol that we've been given, and that's the protocol we intend to follow. So obviously, having information about that individual is going to be very, very important.
Next question is from Laura Hancock at cleveland.com.
Hi, Governor DeWine. I have a question about just coronavirus data. There's a study going around on the internet saying that infections across the world, take it for what what you may, but it says that Ohio is after Tennessee in terms of infections per 100,000 people. And then there is another, when I went onto the CDC website, it looks like we're number 5 right now after states like Tennessee, Arizona, Oklahoma. And so I was just wondering, are you planning to do, instead of like recommendations and, suggested protocol, are you planning to, if we're really this bad in relative to other states, are you planning to do more like mandates?
Well, we are high. Look, there's no doubt. We've said this, press conference after press conference. We're exceedingly high. This is not where we want to be. Again, we have put out the protocols, and if we can get people to follow the protocols, and look, Ohioans beat this back twice before, but we're in a worse position today, frankly. We're in a worse position than we have ever been in regard to this virus. So, the next few days are absolutely critical. We saw a little downturn in cases today, but, it's still, even if it stayed at that number that we showed you today, it's still much too high. It's still an exceedingly high number. So, we're very concerned about it, deeply concerned.
Next question is from Alex Ebert at Bloomberg.
Thanks for having us, Governor. When it comes to these vaccinations, we're really interested in tracking them across the country and seeing especially what kind of demographics data we can find. Initially when Ohio was responding to the coronavirus, we were noticing a differential in the infections between people of color and those that were white in Ohio, and higher infections of people of color. Is the state going to be producing data that shows the vaccinations per demographic groups, ages, yes, race, that sort of thing? And how are we going to be able to see that? How will you guys make that available to us?
Yeah, we're going to put it up. It's going to be a dashboard. We showed yesterday kind of a mock-up of the dashboard. It's going to look like what you saw on the screen yesterday. We don't have it up yet, but you'll be able to break it down by county. You'll be able to break it down by race. You will be able to see what percentage of the African-American population, what percentage of the Hispanic population of the state at any one time has gotten the shot. And so you'll be able to compare that. You can see how many people who are white, what percentage of that population has gotten the shot, African-American, Hispanic, and on and on. So yeah, you'll be able to look. It's just very transparent. And, we'll look at it. And, if we see that there's a discrepancy there or disparity, we will be able to act on that. And that's,
Governor,
it's important for us to watch that.
Governor, could I just add, because there's been a couple of questions about this, that we will protect people's privacy. We want people to get access to the vaccine. We'll try to make information available, but the individual, the person's privacy, will be protected. We have an obligation to do that because we know that will encourage people to get the vaccination, which is a goal we have.
Next question is from Jordan Laird at the Dayton Daily News.
Afternoon, Governor.
Afternoon.
A lot of Americans and Ohioans have indicated they are skeptical of the coronavirus vaccine and reluctant or outright refuse to get one. How does the state plan to address vaccine skepticism, especially in Ohio's minority communities that have some legitimate historical concerns about healthcare?
Yes, absolutely, they do. Legitimate historical concerns. And, we will have specific messages for the people of the state of Ohio. We certainly will do it for the African-American community. So we'll be showing you some of those things in the days ahead. I think it's also important for every Ohio citizen. Talk to your primary care physician, talk to your doctor. They're the ones that, I would say that you should listen to. I think also in the days ahead, people are going to be watching on TV. They're going to be watching the FDA people. They're going to be watching, health experts in regard to this vaccine. They're also seeing today, as they saw yesterday, healthcare workers who are getting vaccinated. And, I think the more people get vaccinated, the more comfortable everyone else is going to be to get vaccinated. But yes, it's certainly something that we are focused on.
Next question is from Marty Schlayton at the Ohio Capitol Journal.
Hi, Governor.
Hey, Marty.
So obviously we've got 2 effective vaccines that are coming out. Have you heard anything from the feds about whether production of these vaccines can be scaled up, since we know they work, or is the reason that so many are coming out the door now was a lot were pre-produced pre-approval?
Yeah, Marty, I don't think we've got a clear answer on that. We believe that it's going to be a steady stream, and we hope that we're going to see additional companies come in so that we're going to have more than 2 streams coming in. We'll have 3 and 4. We don't know that. So we hope that this will continue to grow, but I don't have a crystal ball, and so I can't really, nor have really we've been told specifically where this goes beyond the first 2 months. The first 2 months, we've been given some indication, roughly 660,000 per month. But beyond that, that's about all I can say. That's all I know.
Next question is from Trevor Peters at WXIX in Cincinnati.
Hi, Governor. Curious as to why the UC Bearcats were denied an attendance variance from the state for Saturday's AAC championship game when ones have been given to the Browns and the Bengals in the past.
Yeah, I'm working on that today. I've got a call with UC's president, President Pinto, and he and I are going to talk about it. So I'm looking into it. I don't know what happened, but we're going to try to get. We worry about the safety. We also try to be equitable. The goal is to put people in a stadium where they can be safe, far enough distance apart. Everybody wear a mask. Obviously, it's outside, so we think that it can be done safely. But we're looking at that now, and I really don't have anything to announce today, but we'll have something shortly.
Next question is from Adrienne Robbins at WCMH in Columbus.
Hi, Governor. My question is for you or for Dr. Vanderhoff if he's still on the call. I understand these numbers are changing, but when you look at the pace of vaccination in Ohioans versus the pace we're seeing Ohioans being hospitalized, are we still concerned that our hospitals could become overwhelmed, or are we hopeful that the vaccine will bring enough relief, especially since it is going to those healthcare workers who we were concerned about becoming ill probably the most?
Well, I'll take a shot at it first, and then I'll turn it over to the doctor. But look, we got to deal with this ourselves. This vaccine is not going to cover enough people quick enough to get us out of this. I mean, eventually it will, but we're at a very, very high rate today. And the rest of December, January, February are probably going to be hell unless we turn this thing around. Let me just be blunt. So no, we should not interpret this, the good news of the vaccine as anything but what it is. You know, good news, but it will not get us out of this. I mean, just think about this. The first person to get a second shot in Ohio is not going to happen for another 3 weeks. Only after 3 weeks are you then going to start getting people who have the second shot, and you're going to start moving them, we hope, out of the possibility of the range of getting it. But at the rate of, if we get 660 vaccines this month, 660 next month, we got a long way to go. So it's good news. We're happy about it. We're excited about it. But this is not going to get us out of this. We have to take ourselves out of this. Doctor?
Thank you, Governor. Now, I'd agree with you. Look, here's how I'd characterize it. This is, in fact, history in the making. Never before have 2 effective vaccines with such an incredible safety profile been developed and delivered so quickly. I mean, scientifically, this is not unlike some of the milestones in the space program. So it's a moment we can be very proud of. But the arrival of the vaccine is signaling to us that we're being able to pivot from just being able to play defense to now having both an offensive and a defensive game. But we can't stop playing defense, wearing our masks, keeping our distance, if we want to win this game, because you're absolutely right. It's going to take a while before we vaccinate enough people in Ohio that we can even begin thinking that way. Today, we have to continue to focus on the important mitigation steps that we've been talking about now for a very long time. Because if we don't, our hospitals will get overwhelmed.
Governor, next question is the last question for today, and it belongs to Shane Stegmiller at Hannah News Service.
Good afternoon, Governor. How are you doing today? I wanted to ask about Senate Bill 311, which you vetoed. Have you been discussing with the legislature possible compromise so they don't go and override that veto, possibly maybe removing criminal penalties for violating certain health orders or some kind of negotiation?
Well, I have learned a long time ago that when you get down to the wire on discussions, it's probably better not to do it in public. And so I'm going to duck that question openly and not answer it. We're in discussions, and we want to come out of this with a health department that is not crippled, not hurt. And I've made my position very clear, and my position is not changed. So we thank you all very, very much. And I know yesterday I said we'd see you Thursday, and now we're back today. But barring something unforeseen, we'll be back here at 2 o'clock on Thursday. Thank you very much.